Welcome to the first Chamber Chatter of 2026. I am delighted to be here with Dr. Rameau from Johns Hopkins All Children's Hospital here in our Emery's Rock podcast studio. We're so excited to hear not just about you, but we love you, but also the fact that Johns Hopkins is here in our community. So, Dr. Rameau, you are an OB-GYN.
That is
right?
correct. That is correct.
So the most common question I've gotten from people is it for just children, OB-GYN?
I, right now, am taking care of primarily adult women and their gynecologic needs. Because we're part of Johns Hopkins All Children's Hospital, I do have the fortunate opportunity to also work with adolescent children. And it's actually pretty unique because I get to see them very early on in their development of womanhood.
Right. And get to catch it, just follow them through.
Exactly.
So you are an OB-GYN. Did you always know you wanted to be?
That is...
Or a doctor or just OB-GYN?
That is a great question. It's actually one of my favorite questions.
Is it?
So I am pretty lucky to have known most of my life that I wanted to be in healthcare and functioning in the capacity of a physician. What I didn't know is the specialty. So throughout my medical journey, and you're exploring different fields and different specialties in medicine, I was fortunate to have patients that made it very clear to me that OB-GYN was my calling. So there were times where they opened up to me because they could relate to me in a very different way, and it's the first time they were able to with a healthcare provider. And that just made it clear to me that I could be their advocate, and that's how I figured out OB-GYN.
So what was your healthcare journey? Did you start out knowing you were going to be a physician or nurse practitioner, somewhere in between, or?
My parents would laugh at this because they always say we sat at a dinner table and my elder sisters are like, I want to do business, I want to do education. And then I was like, I want to be a doctor.
And look at you. I met your parents.
You did.
I did meet your parents at your ribbon cutting that we just had recently. Very cute family, and your dad was very, very proud.
He was.
And he is, and I would be as well. Where did you study?
Absolutely. So my formative years, I actually was overseas. So I did a lot of my early education with more of an international approach. And for undergraduate studies and my master's, I moved to DC, where I did a master's in public health. And for medical school, I then moved to Virginia. And then about 4 to 5 years ago, I moved to Florida for residency, and I have called it my new home.
Right? That's what happens. People come down here for a little bit, whether it's a vacation or a conference or something. They're like, this is pretty great community. Right?
I think once you experience the Florida culture, it's something you can't really leave.
I know. And your new practice is on 54 in Land O'Lakes.
That is correct.
In the brand new beautiful building.
It's gorgeous.
It is gorgeous, and it's comforting, and it provides that environment. And I know that that's important for you in women's care.
Certainly. Again, so fortunate to have found this community. Our medical director emphasizes taking care of the community, and the way the clinic is built is for a woman to walk in and, just like you said, feel like she's at home, and whatever she needs to discuss will be addressed that day. And that's really my approach. When you come in to see me, that's what you should expect. Our first few minutes, we just sit down, and I want to get to know you. We establish a relationship, and I answer your questions, and we go into counseling.
It's such an intimate profession, and that's why I think the counseling is so important, because as a woman and having a baby and going through all of the things that we have to go through, it's a relationship.
Absolutely.
And you have to build that with your patients. And Johns Hopkins has such a brand that I'm sure you were excited to be a part of, and especially to be a part of something new in this community and what it means for our community. Because I think I was sharing with you a few years ago, we didn't have a lot of OB-GYNs, especially those delivering. And so having you here is great for the community. Where do you deliver?
So right now we deliver at the HCA Trinity Hospital in Pasco County.
Okay.
I will say that right now we're focusing on GYN care. However, once we add on more physicians and other providers, we will aim to start the obstetrics parts and help pregnant patients as well.
Awesome, because I don't know if you know this, but last year there were 1,000 babies born just at Advent Health Wesley Chapel.
I see.
That's a lot of babies.
That is a lot of babies.
And that's like, okay, school board, 5 years from now, we're going to need a new school.
Our population is increasing, and they definitely need more coverage and
Right.
access. I agree.
So what's your favorite thing to do here in Tampa?
That's a wonderful question. I really love music and dancing. It's funny, in residency, my co-residents always said, wherever she is, there will be some type of movement and dancing.
Oh, that's awesome.
So in Tampa, I have found myself going to a lot of live concerts and trying to enjoy the music and
The music scene.
Music scene, yeah.
There's a lot of venues
There are.
in Tampa. You can go from a small theater to the amphitheater to the arena and even stadium.
And I love that a lot of the events are also outdoors, so you get that variety.
Yeah. Are you going to Bruno Mars?
When is he coming?
He's coming October, I think.
I might see you there.
I'm waiting for a sweet pass, so if I get one, I'll let you know. I don't like the outdoor crazy chaos of but I love live music too. And so now, Johns Hopkins, I've worked a lot with them on the hospital project, and I know that they want their physicians to live in this community. So are you a resident of our community?
I am. I moved to Land O'Lakes this past July, and I've slowly started to get to know my community and everyone around me.
Don't you love it?
They are very welcoming.
That's what I love to talk with people about, is their experience within our community, because it's a very unique place. I was meeting with a lady yesterday who's bringing her business here, and I said, no one's from here. We're all, and she goes, there's a few, but we're all transplants.
Right.
So we have a more open conversation. I lived in a community and everybody was from there, and it was really hard to make friends, especially at a certain age. You know, it's not like you can just go to school and find your friends.
Right.
You gotta really work at it.
No, that's very true. I have found that people will see each other in scrubs, for instance, and they say, hey, what office do you work for? And you slowly meet people this way. So this community is definitely very unique.
It is, and it's one of the fastest growing in the nation with population, hence 1,000 babies being born last year.
And more to come.
And more to, I'm sure there are. What is it, the 9 months after New Year's is, what is that, August?
August.
August is like a baby, the population boom. the
Our
baby
annual
boom.
baby boom.
The annual baby boom. That's so awesome. So tell us a little bit more about the actual office itself. How many people because you had a pretty large staff, but you're the only provider.
That is correct.
Okay.
So right now we have been able to fill most of our positions. It's exciting because we have a full working staff right now. We have 4 PSRs. They are the front face. So they welcome our patients, they make sure that they feel welcome, and we have our checkout staff who end the visit. And they are also very, very welcoming to everyone who comes in. We have our clinical supervisor who makes sure the office is running just as it needs to. We're fortunate to have a ultrasound technician who has incredible experience in both OB and GYN.
Okay.
So the care that you get from her is exceptional as well. We have our medical assistants who help us out with blood work and kind of getting the patient into care into the office so I can see them. And then our nurses who are fabulous at answering all of the questions when patients want to follow up. And then you have myself, the physician right now. And like I said, we'll definitely be trying to bring in new physicians and maybe other providers like nurse practitioners, etc. So that's something to look out for.
Yeah, because you guys have some space to grow in that office, and yeah,
absolutely.
I think they did such a fabulous job with the colors. We can keep going back to that, but
it's funny. I noticed after my first few visits, one of my patients says, "Mom, I can't wait to come back here." And she just loved being in an OB-GYN office, which is not something you get often.
No, that's like the least place a lot of us want to go.
Exactly. So I think you're very spot on. The way the office is built definitely makes it feel like home, and you do want to come back.
Right. So you're accepting new patients.
We are. Right now, we have many slots to see patients again in all phases of life. I do see a lot of adolescent patients. We do see a lot of adult patients, and we care for a variety of conditions. Abnormal uterine bleeding, specific conditions like endometriosis, PCOS. I have also received a lot of patients with perimenopause and menopausal issues. So we see the whole thing.
Yes. I was sharing with somebody else just a few minutes ago. I went outside because it was a little warm in here. And I go, I'm a woman of a certain age. And he goes, oh, so is my wife. She's doing this program. And I go, we're all aging together at the same time here in this community. So it's interesting that, now that we have somebody here that can help us. The whole spectrum. And I love that for you. As a woman in this industry serving women, what is something that really resonates with you in your patient care?
I will relate this back to family experiences. I know I have had family members who see a physician and they leave, and maybe all their questions weren't answered, or they felt nervous to ask all the questions and they didn't know what to bring up. And for me, what resonates is knowing that history for a lot of patients, being able to change the narrative. So when my patients come in, I try to make sure they know whatever they want to ask, this is the time. I will take my time so that you can feel, when you leave, you don't feel like any question was missed.
It's really important, again, because it's that relationship, and they can start having that conversation with you. And I'm sure, all of us, as we leave a meeting or an appointment, we're like, oh my God, I wish I would have asked that.
I forgot that one.
I forgot that one. I forgot this. Oh, I forgot to tell her that I'm taking the blood pressure medicine, or whatever the case may be. And so to be able to have that time is...
And part of what you said is also true, because I can definitely tell them to ask all the questions, but I do try to say the door is still open. If you leave, there's always a way to reach us. And they definitely maximize the usage of that too, the after appointment care.
Yeah, and again, that's important. All right, we're going to go back to the personal side.
Yeah.
First concert, best concert.
Oh, yay. That's a first concert and best concert. First concert, I think, was Backstreet Boys. Right?
Yeah.
My older sisters, they got me into boy bands a long time ago.
Oh, listen, there is no shame in that. Mine was New Kids on the Block. But
I love that.
Right?
My best concert is actually, surprisingly, electronic music.
Okay.
So I actually went to an Avicii concert when he first came out for the EDM scene. And it was just a magical experience.
So we're going to see you at an EDM concert,
You might.
Oh my gosh. We're breaking news here at the chamber. I can't stay up that late, so.
I know. I'm getting to that point too.
Again, woman of a certain age. I can't stay up and party that late.
That's funny.
Well, I am so delighted to have had you on here and share kind of your story, and that you live right here and you're with Johns Hopkins and you've got such a gift for the women's care here in our community. And I really thank you for taking time out of your day.
I very much appreciate you having me. When I received the invitation to be a guest, I said, absolutely, let's talk about women's care. Let's get the Pasco County women to know we're here and we're ready to take care of you.
That's right. And I think we're going to have you as one of our speakers at our future events for leading ladies. I think we were trying to work on your schedule for that too. So,
that is right.
So you'll be seeing her around, and she will be at the grocery store if you need to.
You'll definitely see me there.
Dr. Rameau, it's great to have you.
Thank you.
Thank you.
Thank you.